Hello, everybody. This is Dr. Mac, Health Leaders Journal, and tonight I am reading an article by Philip Betbeze from healthleadersmedia.com. Health Leaders Media magazine is published by healthleadersmedia.com, and this article was published in September 2010. And Philip Bees interviewed several CEOs of hospitals operating in United States. Actually, he interviewed four people who are not all CEOs. One of them is a president, and his name is Harris Negler, MD, and he is the president of Beth Israel Hospital in New York. He also interviewed a lady by the name of Deborah D. Visconti, who is a senior vice president of a hospital which I'm yet to discover. And he interviewed Richard Freeman, who is a CEO of a hospital I'm yet to discover, and then Dr. David B. Bernard, MD, who is a CMO or Chief Medical Officer of a hospital that we shall discover as we go along. Now, what did Philip Betbeze find out? He found out that these people who reside in the C suite in a hospital or in a healthcare system actually have the power, all the power in the organization. And in the discussion, he stated that some CEOs want individual go-getters to blaze their own path through a variety of new initiatives. But in listening to all these leaders, he found that most seem to favor team-based approach to decision making, mirroring the way many hope to organize their clinical employees into team-oriented, cohesive wholes rather than just a loose collection of free agents protecting their own turf. So the idea of team-based approach came up immediately. And Dr. Harris Negler, who is the president of Beth Israel Medical Center in New York, said that lots of healthcare systems don't really function as system. They're just system in a name, and the healthcare system do not share many of the infrastructure. Particularly, they don't share many of the elements of the IT infrastructure and the things like electronic order entry that contributes to systemness. And because of that, the healthcare system has experienced difficulties that are not unexpected, but they can be solvable by collaborative working environment. Okay? So Dr. Nigler is a physician, of course, and he said one of the advantages of having a physician as a president in Beth Israel is that he mediates between the physician side and the administration side, and his job is to make sure that they maintain a perspective for both groups so that they can collaborate to ensure success. So there's something to be said about having a physician as a leader. Now, another important point that Philip Betbeze has mentioned in this article is an observation that big changes are coming for hospital revenue streams. And the hospitals that are able to best incorporate the clinicians into the leadership role in the hospital system will have an early mover advantage as payers on both commercial and government decide to push greater coordination of care through targeted financial incentive. This is a very important point that the author is making here, and he's suggesting that incorporating clinicians into the leadership roles in the hospital system will have an early mover advantage because the payers on both commercial and government side will push towards greater coordination of care through targeted financial incentive. What are we hearing? We're hearing about greater integration of physicians into the leadership roles. Alright, so that is that about that point. I think another point I notice here is about, do titles matter in say like titles like CEO, COO, and the like. And Dr. Negla said that titles don't matter until they do. Most of the CEOs said that titles do not matter until they do, because there is all this alphabet soup in the C-suite, like CEO, CEO, COO, C this and that. But what matters is that you, as a CEO of an organization, is that you're able to create a collaborative leadership, and creating collaborative environment in an organization is extremely important. To put it in exact word of Dr. Negla is that a collaborative person is extraordinarily important. Okay, so having titles sometimes can help, but you need to create titles in an atmosphere of collaboration. Alright, so some few key points to remember about this article is that it's very another point that came out is rebalancing with clinical leadership. Given the increased emphasis many payers, not the least of which include the federal government, are placing on clinical pathways, patient satisfaction, and readmission rates, many CEOs are eager to populate their C-suite with leaders who have clinical background. Often physicians are recruited to fill these roles chiefly because they carry authority as peers with a group of individuals that is extraordinarily very difficult to manage. Alright, we are saying that physicians are extraordinarily difficult to manage, so having some physicians in the C-suite kind of helps you to cope with that. And many CEOs observed that physicians actually prefer to have a physician leader to be one of their leaders. So these are qualitative data, and maybe it is true, but it remains to be tested to find whether physicians respond better to physician leadership or not. Nevertheless, this is a great article, and if you want to read the entire article, you can go to healthleadersmedia.com, healthleadersmedia.com, and the article is written by Philip Bez, who is a senior leadership editor with healthleadersmedia.com, the issue for September 2010. Thank you so much for listening.